Nurses at 5 University of California hospitals are concerned about staffing levels that they consider unsafe, and they're threatening to go on strike. KPBS health reporter Kenny Goldberg joins us now to discuss the story. Kenny, why are the nurses concerned about the staffing levels at these hospitals?
Well, California has strict nurse-to-patient ratios in all hospital units, and nurses can never take care of more than 5 patients at a time in a regular unit, and in intensive care units, for example, they can only take care of 2 patients at a time. And what nurses are saying is when they go on breaks or they have their meal breaks, there's not enough nurses to take care of the other patients, so that their colleagues have to double up on patients, have to provide relief for them in an ad hoc way while they go on a break, and it's just not right.
And it probably makes it less safe for the patients, I would assume.
That's what nurses say. Now, the administrators say we have charge nurses and other supervisory nurses that can sort of cover while you're gone and while they're on breaks, and therefore we are in compliance with the ratio laws. That's their argument.
So what do they hope to accomplish by going on strike?
Well, to show the UC system that they're serious about it. I mean, what's interesting about this labor dispute is it's not about money. They're not arguing over money. They've already settled that whole issue. But it's about working conditions that nurses claim are really unsafe and puts them under a lot of pressure. They feel responsible for their patients. So they want to be able to take their breaks and not have to worry about it, not have to sit with their pager looking as they're eating their hamburger or something and be called right back into the patient room. So that's really the issue.
But now there is a restraining order on those nurses and they cannot go on strike. So what reason did the judge give for doing that?
The judge agreed with the UC system that says it's a public health threat if all the nurses walk out for a day. Mm-hmm. Now, both sides are headed back to court next Friday, at which point they'll haggle out all the legal arguments. There's also a no strike clause in the nurses' labor agreement, but the nurses say it's suspended when they've reached a contract impasse, which they have. And also they're saying when there's patient safety issues, they should be allowed to go on strike because they're striking over a patient safety issue.
And they're striking to call attention to it so that the public might put some pressure on it as well.
That's right.
Is that
That's
part
right.
of it?
That's exactly right.
So is there a chance then that the nurses could still strike after that hearing next Friday?
Well, obviously it depends what the judge says. They want to have that option in their toolbox if they're allowed to, so they can exert that kind of pressure on the system, because otherwise what can they do?
Well, what happens to the patients in the hospital if they do strike?
That's a very good question. Well, I guess the supervisors would have to get in there and work on the floor. They'd have to hire a lot of traveling nurses. But we are only talking about a day. They're not going to walk out for a month or anything like that.
How many nurses are we actually talking about, though? Well,
in San Diego, about 1,200 nurses would walk out. Statewide, over 11,000. So that's a lot of people.
It is, and a lot of patients. Okay, well, we will keep an eye on this. We should know more after the hearing.
That's right.
Okay, thank you very much, Kenny Goldberg.
Thank you.